Let's program myself.
She loves that camera.
It saved my butt more than once.
Are we having a funeral?
Anybody waiting for Aaron?
So what I need to do, if I can write it here. Everybody got some quiet.
At this time, I'd like to thank the RFP committee, the due diligence committee, the attorneys, and all those that have spent their last year working through this process. I know it's taken a lot of time. We're down one of the members because it did take a lot of time. I think it's been a community effort to make sure that we make the right decision. However, sometimes the decisions we make become political. Sometimes the decisions we make are from the heart. Some of the decisions are made because of financial reasons. But during the whole RFP process, the 6 members plus the staff members dedicated a lot of time to travel to the 3 hospitals. They spent time listening to the proposals. The due diligence committee tried to negotiate and work through their best efforts, a deal that would be acceptable and work through the community to the long-term stability of our healthcare system. Tonight, both boards are, I guess, the hospital board in which Commissioner Winslow and ourselves are part of, have made a decision to move forward. I think our attorneys are trying to revisit the motion which has been made. And so, Mr. Chairman and Chairman, I'd like to thank y'all for moving this forward and trying to improve the health care and the quality of care and the efforts of all of our citizens in our community. Hopefully this is our best decision, and our efforts will come to fruition as we move forward into the future. Thank you.
Thank you, Commissioner Griffin. Anybody else would like to comment about the process?
I think all of us are certainly thankful for all the efforts and the work that's gone into this, and certainly it's been a long, drawn-out process there. And probably that may be part of the problems that we've had here at the hospital, because of the process has gone out so long and so much insecurity for the employees. So I'm glad to see it's coming to a head.
Upstairs.
Yeah, let Dr. Sterry make a motion.
Dr. Stern.
Okay. All right. At this time, I'd like to call on the Chairman Twitty to give his report from y'all's meeting.
Thank you, Chairman Dixon. We just finished meeting, and we just had a vote in open session, and it's the recommendation of the Albemarle Hospital Board of Commissioners that we recommend to the county that you move forward with Sentara.
Thank you very much. At this time, it's our pleasure to entertain a motion. Sir, do you have a motion for us?
Okay. I move to finalize negotiations for the proposal for affiliations related with Albemarle Health submitted by Sentara, and move to finalize negotiations for the proposal for affiliation related to Albemarle Health submitted by Sentara, all as instructed by the boards to their attorneys. Further, I move to authorize the chair to oversee the final negotiations by this board's attorney, working in conjunction with the Albemarle Hospital Authority and their attorneys, of a letter of intent and something sheet with Sentara, and to authorize the chair to execute such letter of intent and term sheet, okay, on behalf of this board as finalized.
I'd like to second that.
Okay, you heard the motion, you heard the second. Any discussion on this? I can't, I feel like I need to say this, but this really starts another long process, and I have to say this on behalf of the board, that there's still some county-related issues, hopefully, that we can get ironed out. That is probably different from the hospital authority board. So But you've heard the motion, second. Would anybody like to say anything, discuss?
Question, Mr. Dixon. So as the process is tonight, we've heard the recommendation from the hospital authority. And the motion is that there's still some areas in which have to be finalized based on what we've heard from our attorneys. Is that where we've not come to a conclusion with that all the terms have been met with the Sentara proposal, but however, we feel that there should be some concerns that have to be finally addressed?
Yes.
I would also like to thank everyone involved in this process. And we know that people like Althea Riddick, she got to drive to Gates County tonight. and other people had to get home and do other things. It's been a tremendous learning process for me, and you should be saluted for all of your work. And the physicians have been very supportive. Where'd Neil go? Neil's still here? Yeah. We appreciate you fellows helping us out during this whole process. Okay, thank you.
Any other discussion? All right, all those in favor, I ask you to raise your right hand. All those in favor, right hand. All those opposed, left hand. Like 100%, motion carries.
Jeff, may I make a comment?
Sure.
I know when we brought y'all this idea over a year ago, that we knew it was all going to be a tough process on everybody. We appreciate the county working with us. It's been a learning experience for all. I think that you've made a good decision for the future of healthcare in this region tonight. And I want to commend you and thank you for what your group has done. And I hope that everybody understands, especially our employees, that just because we have a vote tomorrow doesn't mean it's over. We still got a long ways to go.
Exactly.
And I don't want anybody going over the top and thinking it's going to be a new day on Wednesday or Thursday. We got a long ways to get across the line.
Right.
But thank you for everything that y'all did on behalf.
Chairman Wood, I'd like to thank you for being in the realms of your board. I'd like to thank your board. I know it's been a very hard process for you. I know that you have personally taken a lot of heat, and there's been a lot of unkind things that have probably been expressed your way. And
Thank you.
thank you for taking that. You're a true man, true gentleman, I'm sorry. And I want to assure everybody that my vote tonight was based upon what was in the best interest of this community as far as health care was concerned, and any other factors were secondary. Thank you.
Thank you.
Yeah, Commissioner, if I make a comment.
I'd like to say, Mr. Twitty, I appreciate you taking the heat from me. I got the heat from somewhere else, and I passed some on to you. And you have taken it very kindly. And as I said before, I have nothing personally against you. I thought for the best interest of the people, of the employees of the hospital, and that's why I asked you to do that. You have treated me with respect, and I appreciate that.
Thank you.
Mr. Barrett?
Being the senior member of this group, I would like to certainly thank everyone and say to you that hopefully at this moment will bring us all together so that we can actually work closely together as a community, because I think our communication can improve. And I think that's something that we all need to think about, how important it is for us to learn how to respect and treat one another in such a manner that we can focus on just one point. Right now, health care is important, so I'd just like to say thanks again, and let's work together for the future of Elizabeth City, Pasquotank County, and all the other areas that we serve.
Thank you, Mr. Berry. Vice Chairman, your last one.
It's been echoed many times, but thank everyone. I hope the paper tonight can convey how hard these two committees have worked. If the people of Elizabeth City could only understand how long and hard these individuals have worked on this issue and have worked for the best interest of all the people in northeastern North Carolina, they would thank them, and I thank them personally, each one of you, for the care and diligence you put into this process. It hasn't been a quick process, but hopefully it's the right choice, and we've We've had great anxiety over it and great stress each one of you have, but hopefully it's all that will be all worthwhile. Thank you.
Our legal team, y'all got any follow-up orders or anything to comment?
Not for open session.
Not from. Okay, and then I'll entertain a motion to adjourn.
Motion adjourned, Mr. Chairman.
All in favor say aye. Aye.